Syphilis. What is syphilis? Syphilis is a bacterial infection usually spreads by sexual contact. The disease starts as a painless sore, typically on your genitals, rectums, or mouth. Syphilis spreads from person to person via skin, membrane, contact with these sores. Common symptoms of syphilis. Syphilis develop in four stages, each with a different set of symptoms. First, the primary stage. The first sign of syphilis is a small sore. The sore appears at the spot where the bacteria enter your body. While most people infected with syphilis develop only one sore, some people develop several of them. The sore usually develops about 3 weeks after exposure. Many people who have syphilis don't notice the sore because it's usually painless, and it may be hidden within the vagina or rectum. The sore will heal on its own within 6 weeks. The secondary stage is within a few weeks of original sore healing, you may experience a rash, but eventually covers your entire body, even the palms of your hands. The rash is usually not itchy and may be accompanied by wart-like sores in the mouth or genital area. Some people also experience muscle aches, fever, sore throat, and swollen lymph nodes. These signs and symptoms may disappear within a few weeks, or repeatedly come and go for as long as a year. The latent stage. If you aren't treated for syphilis, the disease moves from the secondary to the latent stage. When you have no symptoms, the latent stage can last for years. Signs and symptoms will never return, or the disease may progress to the third stage. The third stage of syphilis is about 15 to 30% of people infected with syphilis who don't get treatment will develop complications known as the third stage of syphilis. In the third stage, the disease may damage your brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years after original untreated infection.
Risk factors. 1. Engage in unprotected sex. 2. Have sex with multiple partners. 3. Who has sex with men. 4. Are infected with HIV, the virus that causes AIDS. Prevalent rate. Considered a rare disease. Affect less than 200,000 Americans. 70,000 cases a year. Around 0.3% or 70,000 people in the USA. About 1,000 deaths from syphilis in the Americans 2002. It's from the White House report 2004. Prevalence rate worldwide. 12 million worldwide cases. About 89,000 deaths from syphilis in Africa. About 1,000 deaths in Americans, 43,000 deaths in Southeast Asia, 1,000 deaths in Western Pacific in 2004.
Prevention options. First, abstain from vaginal and anal intercourse and oral sex. Second, if you choose to have vaginal or anal intercourse, use female or latex condom every time. Third, giving or getting syphilis during oral sex is rare, but you can further reduce your risk by using condoms or latex or plastic barriers. Fourth, avoid sharing sex toys. Fifth, avoid having sex with multiple persons. Treatment options. The preferred treatment at all stages is penicillin, an antibiotic medication that can kill organisms that causes syphilis. If you are allergic to penicillin, your doctor will suggest another antibiotic. A single injection of penicillin can stop the disease from progressing if you have been infected for less than a year. If you had syphilis for longer than a year, you may need additional dose. In the future, having periodic blood tests and exam to make sure you are responding to the usual dose of penicillin. Avoid sexual contact until treatment is completely down, and blood test indicates the infection has been cured, and be tested for HIV infections as well.
Recently, we found an article about syphilis that syphilis can be just diagnosed with a blood test. A single dose of penicillin is enough for a person who's just been infected for 1 year or less. There are alternative ways for those who are allergic to penicillin, such as tetracycline. If syphilis is left untreated, it can cause serious and permanent problems such as dementia, blindness, or death. A pregnant woman has both chance of having a stillbirth baby or of giving birth to a baby who still dies shortly after birth. To prevent syphilis infection, you have to avoid intimate contact with a person you know is infected or use condoms with those who are not sure to be infected. A person with syphilis who is treated late could result in getting permanent damage to the heart and brain.
The second article we found about syphilis is the serologic response to treatment of infectious syphilis. The objective is to evaluate the serologic response to treatment of patients with infectious syphilis. There are a total of 1,090 patients were entered, and 857 with primary syphilis, 183 with secondary syphilis, and 50 with early latent disease. And with the measurements and main results, we get the conclusion that an adequate therapeutic response for syphilis must be based on illness episode and the pre-treatment RPR titer. Triple pneumo test can demonstrate thorough reversion after 36 months, and a negative triple pneumo test does not rule out a past history of syphilis.
The third empirical evidence, the availability of increasing number of EIAs for detecting syphilis antibiotics, makes it appropriate to review approaches to syphilis serology and to access the role of syphilis EIAs in routine diagnostic microbiology laboratories. And such specimen may be referred to the PHLS laboratories that provide confirmatory testing for reference testing and to facilitate collection of surveillance data on what remains an important public health problem.
Finally, we found an interesting theory about syphilis, and it is called the Columbian theory. The theory simply talks about Mr. Columbus brought back syphilis from the Old World to the New World. However, the researchers can't find enough evidence to support their theory. But at the same time, they find an interesting evidence that maybe the syphilis is from the seafood. 16 reports that did meet the criteria for syphilis came from coastal regions, where seafood was a large part of the diet. Then the seafood contains old carbon from deep, unboiling ocean waters. As such, they might fall prey to the so-called marine reservoir effect that can throw off radiocarbon dating of a skeleton by hundreds or even thousands of years. To adjust for this effect, the researchers figure out the amount of seafood these individuals ate when alive. Since our bodies constantly break down and rebuild our bones, measurements of bone collagen protein can provide a record of diet. So with these results mentioned, maybe the syphilis is from the seafood, but the origin of syphilis is still a fascinating and compelling question, and the current evidence is pretty definitive, but we shouldn't close the book and say we are done with the subject.